The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's wonderful to have you with us in this dimension of House Call. Wow, what is chiropractic? Your feet? I guess we could subtitle the program as saying the stories your feet do tell if you listen to them. And we're not talking necessarily about aches and pains and corns and bunions, but the feet do tell stories. The problem is that a lot of people don't realize that. The problem is there's a lot of chiropractors, and based on our experience of having so many patients come to us who have been to other chiropractors, and we always start their exam at their feet and work their way up, because many times the feet really are the foundation of the body. We're walking on stilts, and if there's something awry in our feet, it's going to affect not just our feet, but our ankles, our knees, our hips, our pelvis, our entire body framework. So that's what we're going to talk about today. So we're going to begin with a slide that says the absence of disease does not necessarily indicate the presence of wellness. What does that mean? It means that even though right now I'm healthy and I feel good, doesn't mean that health and wellness is going on inside of my body. So we're going to look at some signs that would indicate the possibility of some impending process going on, and we're going to first begin with Dr. Jensen discussing some vertebra, because the brain is like an electrical generator, the spinal cord is like the main power line, the spine therefore is like the switchboard in the nervous system, and that switchboard not only affects our bones, our muscles, our ligaments, our tendons, but it also affects all of our organs as well. So Dr. Jensen is going to spend a little bit of time talking to you about this, a subject that we know a little bit about called subluxation. It's the thing that chiropractors are well educated in, and we can't overemphasize the importance of you, if you're going to go to a chiropractor, that you go to one whose office and clinic looks updated, and that is a man or a woman who definitely appears to be thorough in their approach to your health care. Dr. Jensen?
Thank you, Dr. Lala. Well, subluxation, as it's defined, is a luxation is actually known as a dislocation. So a subluxation would be an incomplete dislocation of a bone in a joint. It really, you could almost describe it as a malposition of that bone, that has been slid or somewhat or slightly placed in a malposition. And the difference in that is that as we look at joints and how we evaluate them, there's certainly a range of motion in that my finger can only come back so far underneath my own power. However, there's beyond that, and where the joint actually meets where it can go, there's a point there with some mechanical assistance that we call joint play. And so we can see where there's a healthy joint or not in there, whether it's fixated and it comes back, and where that fixation is from in the joint, whether it's muscle or other types of tissue that's restricting it from that. And what we're trying to do is restore that healthy motion. Why? You think chiropractors are all about bones. No, that's not it. Chiropractors are all about the nervous system. And so if we go back to this slide, we can see how those bones and their malposition of those bones affect the nerves. Here we have a window that comes between these bones that houses the spinal cord, and it allows for the free flow of nervous energy to come from that spinal cord out to every tissue of the body. That's every tissue of the body, okay? But what happens is if you have a malposition of the bone and it's pushed back, it actually takes this little window or tunnel in which this nerve comes out, and it compresses it, and it puts pressure upon that nerve, arteries, veins, lymphatics, acupuncture meridians, all those things flow out of these windows here. And so by putting pressure on that, in fact, they find that the amount of pressure that it takes to affect that nerve is about the same amount as if you had a quarter resting in the palm of your hand. If you take a quarter and put it in the palm of your hand right now and see what kind of pressure that is, that's all the pressure you need on that nerve. Go ahead and do it. We'll wait. No, I'm kidding. So what happens is with the pressure on that nerve, it affects that and how it comes out to the rest of your body. Now it all comes down to what the structure of the spine is as to how to manipulate it best. And one of the ways in which we do that is we learn the function or the form of that spinal column. And right here, we call this a motor unit because this is the movable part of this joint. We have two bones. There's two joints here, and this is a big cushion, kind of a joint, and this is what takes most of the weight of gravity. And so we've got the spinal cord following through the spinal canal, and the nerve that comes out through this window. And really, when you have compression there, the first thing that gets compressed is not the nerve, but it's the vasculature that's going to and from the spinal cord to help make sure that it's getting nutrition. And that can affect you up 3 levels up and 3 levels down. So it has wide-ranging effects to have a subluxation there. If we go on to the next slide, we can find from the spinal canal. And sometimes we'll have where the spinal canal, it's actually making it smaller in here, be if a disc is pushing back into this area that's compressing the spine, and that can affect a great deal of things also. We also have 2 nerves that are coming out through either side. These nerves go to every tissue of the body. I mean, we're talking organs, skin, muscle, everything. So that can have wide-ranging effects also. If we go to the next slide, this is from the back part. And as you can see, we have these 2 joints here. And these 2 joints actually have a joint capsule around them. And joint capsules, when they're being irritated, they put more joint fluid into here, so it causes a swelling. And that swelling is one of those things that can obstruct the movement of that joint, such as what I was talking about with my finger. If any of you has ever had a swollen finger joint, you can tell it's much harder to move it past through here because of all that fluid in there. So it's taking away what's irritating that, allowing that inflammation to go down, and it restores the movement of that joint. And so that's sometimes why when you have an adjustment, it takes like 10, 15 minutes afterwards where you really start to feel the ramifications of that as things start to come back and get restored.
That's if it's a real specific chiropractic adjustment based on x-ray findings.
Absolutely.
Because
Absolutely.
when you don't have an x-ray of the spine and you're treating the spine without an x-ray, you're half blind.
Right.
You don't really know what's going on inside of there.
Right. And it's really, it's not only to assess biomechanical alignment as to see if they're lined up and whether it's subluxated. 2 is also to look to see if there's any pathology in there. Things like osteoporosis or cancer or things like that are eating away at the bone, to see whether actually by having an adjustment, whether it's going to injure you further. And something that the chiropractor cannot take care of after that. Because one of the things about our education is not just how to adjust, and we have a great deal of that, a great deal of clinical experience in that going through school. We have a lot more clinical experience than the medical students going through school. It's until they go on to residency that they catch up, okay?
Right.
But for us, we get that, and what happens is a lot of that is when not to adjust.
That's right.
And so you have these people that are adjusting and thinking everything's fine.
Well, they're using some instrument in place of x-ray, and it can't be as scientific as x-ray.
It can't.
Well, let's go on then.
All right. So then, we look at also how all these things will affect the organs. And in this case, you're seeing a guy there who's in a state of malaise. It's not just from having subluxations, but it can be from what's going on in the environment. And of course, how we react to the environment is paramount. And how we react to that is how good the communication system is within our body to all the different organs and functions of that help us handle that. And that's going on to all of these different organs in here, talking about the liver and the intestines and the brain and the pancreas and the kidneys and so forth. And so what allows us to get rid of those chemicals and all that function actually works better when you have a better working nervous system. There's 2 types of communication in the body, a fast response one and a slow response. And the slow response is your hormones. And we know those actions because they change boys into men, girls into women. They make paramount changes there. Same kind of changes that the nervous system does. That's the fast one. It goes right now. You move an arm, you move an arm.
Right.
Okay, so next slide.
Next slide. Here we're going to look now and go through some things briefly for you. Here's an outline of a person, and we see the pelvis is tilted. which is like the foundation of the spine, and it's going to cause the spine to curve or go into a scoliosis like that one does. Now the next slide is going to show us the pelvis itself, such as the femurs and the sacrum, sacroiliac joints, and a few lumbar vertebrae. Then we're going to look at some x-rays here. This is a classical scoliosis. Many of them Dr. Jensen and I see in our clinic, and thank God he's given us some scientific basis to try and help those people, keep them out of surgery and keep them mobile. Next slide here is going to show another scoliosis, but it's even worse. Interestingly, if you looked at the x-ray real close, you would see that they have short legs, and that's what all of those people have had chiropractic care before they came to us, and we found those short legs and balanced out their leg lengths and their pelvis, and they got better. Then here's another scoliosis, a very classical one. This person happened to fall out of a hayloft as a young child, had back problems for years and years, and when they came in, was in a wheelchair, and now does quite well. Matter of fact, had 11 children. Then the medical approach very often to scoliosis is the implantation of what are called Harrington rods. They're rods that they go and cut the ribs, and then they go and sew these rods into the spine, and then they go and straighten out the spine with those rods, but of course it's going to be immovable forever. And then many times these spinal curvatures begin in children. This is a classical scoliosis, rotatory scoliosis in a young child, and then after some very short time chiropractic care, the spine straightened out, and we're still monitoring that spine as the child grows because we want to make sure that there aren't any long-term ramifications. Now, talking about the stories that feet can tell, we're going to show you a slide here of a couple runners. And if you look at the runner on the right in the dark blouse, that foot is relatively straight. So he's not toeing in or toeing out. So we could talk about this like the front end alignment of a car. Is it lined up, or are the tires turned out or turned in? You look at the runner on your far left. In the lighter blouse, we see his foots were turned out. That's called a supination. And so he's going to come down on the outside of the foot. That's going to cause structural stress right up to in his ankles, into his knees, in his pelvis, right up into his spine. And it's going to have ramifications throughout his body. Next one we're going to look at are some pictures of feet. This person also has some yeast infections in the feet, but look at how twisted that left foot is, the one on your right there. It's just, or the right foot, excuse me. It's just, he's been walking that way for years and years, and thank God we were able to help him. And then we see here on the next picture the same kind of an issue. And then on the next picture we see here is just sitting normally. Look at how those feet are turned out, particularly that one over on your left or his right foot. So now Dr. Jensen is going to discuss this a little bit further and talk about this pronation issue. So feet are either going to pronate or supinate, right?
Right. And when you look at a foot as it pronates or supinates, we look at the Achilles tendons that you can see on the back of this foot. Here we have a bowing of the Achilles tendons, and you can see how they're bowing in, and sometimes what these people have, you'll see where it's more severe on one side, they have an inversion sprain that they had, and still dealing with that. A lot of times this is a chronic thing where they have weakness of these tendons over here, and if you put your fingers on those tendons, they didn't know that they were sore, but they really become sore to any kind of pressure on that, and it's fairly light pressure actually too, and they might have a little bit of swelling in there. But the other thing is with the pronation in there, and you can see this person also has a bit of a yeast infection, fungal infection because of the excessive callousing around in the skin here. But this predisposes them towards having a supination of the back foot or the rear foot here, and it ends up with a pronation in the forefoot. And you can see where it's got this kind of a twisting that takes place in here. And so what you'll see if you watch this person walk, they'll actually toe out with this foot as a means there. And what will happen is it'll cause this leg to be shorter, and that will have ramifications all the way up the spine. Now, if we look at the next slide here, to avoid excessive pronating, set your foot down on the outer edge when taking the step forward. So what they're talking about is actually a climbing forward on the outside of the foot as you rock it down like this. That's to try to stop the excess of pronation. Actually, when you go like that, that's a supination. So you're kind of doing a step in almost a partial supination. That's more pronounced. You're trying to do that.
A lot of these chronic athletic injuries that young boys and girls are getting in hockey and football and cross country and soccer are all starting out in the feet, and that's why the athletic injuries that we see, we're always going to look to the feet.
Oh, certainly.
And a lot of times athletic departments or coaches or some of these people running around the sidelines, they don't really have that knowledge and get it fixed. And these kids keep injuring themselves and just cut down their possibility of becoming good athletes or highly functional athletes.
Mm-hmm. And at some point you have some of these coaches who are highly versed in that, and they do recommend some chiropractic care, but it's the chiropractor that you send them to, whether they are versed in these things also.
That's right. Not all chiropractors are versed in them.
No. They try. Mm-hmm. They try to get them
they
versed
want the
in them,
business.
Right. And it's whether you're being complete in your analysis of that. Mm-hmm. So in the next one here, we're finding where a pronated foot, see how it swings out like that on the left-hand side of your screen? You see the difference in the foot, that it is pronated here, where the foot swings out to the side, just like in this. And what happens there is it actually ends up with a diminishing arch here. If you ever walking along a sidewalk with wet feet, take a look at it and see whether you have that arch there or not. That's one way to take a look at it. It's much better to have somebody analyze it directly, but that's something that you can look at. And if you are doing that, see if your foot's pointing out. Second thing is, if somebody puts a corrective wedge in there, it'll naturally correct this so that the foot plants straight forward and gives you a much better stride. Let's look at the next one here. We're looking at the correct technique. Walking with the eyes front and the shoulders back has a corrective measures. You're keeping your eyes forward, your chin tucked in, your arm in close to the torso, your stomach tucked in, your buttocks tucked in, shoulders square, elbows back and back straight. These are all biomechanical things, and a lot of times when you start out walking, you don't have everything coordinated at once. But what happens is as you do it, we start to become more efficient in our walking. And so they find that there's a natural gait that we all tend towards, unless we're compensating for some kind of pain or shortcoming. And that's when we start to put in more of these little corrective measures that we think will help us, but in the long run, they start to deteriorate our health. And the reason for that is that we walk on flat ground, concrete usually, on sidewalks, things like that, and every time you plant your foot, you're putting the same stimulus into the pelvis and the spine and up to the neck. And a lot of times when we find there's foot issues, we find that there's headache issues up here too, that it works all the way up here to the last joint where the buck stops, right there. So these are corrective measures, and you want to look at somebody who's going to look at your gait.
It doesn't matter how fast a person walks or runs or bikes or does exercise, it's the consistency of it.
Right.
Because a lot of those heavy walking, running programs, even biking, are causing microtrauma. So it's the gradual, nice, gentle walk with some consistency throughout the week.
Absolutely. If you look at anybody who's in the sports, they're always looking at the posture. And if you're doing it correctly, and they say, irregardless of how fast you want to do it or what, always take a look at the technique, because it's got to start with a technique and then build from there. And as you look at these world-renowned athletes, such as you look at Tiger Woods, when he went in, he was a great golfer when he first came in. And then there was a few years where he kind of slacked off. What happened? They found that he needed to change his swing in order to have a much longer career. And so he worked and developed on that.
And it was interesting that they began changing his swing from his feet up. Because successful golf is not head down but feet up.
Mm-hmm. And you look at the bicyclists like Armstrong. They said that, yeah, he was a great bike rider and he had all this lung capacity, but when he was young, they said he was stupid. He wasn't intelligent in how he biked, and it came into where he got those people who were informing him on the best posture and things like that. That really made him into the world-renowned athlete.
It took him time to learn to stop being arrogant and submit himself to authority people that knew what was going on.
Yeah, and it's all to various amounts to each of us to do that too. So then we look at the arches of the foot here, and there's 3 arches to the foot. There's C to A, which is the medial longitudinal arch, goes longitudinally along the foot. Then you have the external or lateral longitudinal arch here. And then the third one here is the transverse arch. And this one, as a matter of fact, if that one's gone, we find that the toe will go into that hammer toe and hammer toe configuration and start causing where you have calluses in the mid part of the foot and calluses on the top of the toes. And so we're finding that some ailments that go on, like the corns and things like that, which are actually inflamed bursa that have been just rubbing on a shoe for long, and then it just goes on and starts to make pathological changes, where you can stop that if you catch it.
Some of the inserts that they're prescribing, chiropodists and chiropractors are prescribing for people are just ridiculously expensive, just way out of line as far as the charges they're making.
And if you look at that, a lot of times, like, they'll have magnets put in there. And from me, my formal education was first as an astrophysicist. And doing that, I had to look at a lot of magnetic fields and how their strengths and how they worked. And it's funny how they'll take a magnet, put the north side up here, but right next to it they'll use a south magnet. And as you get further away from that, there's no field at all, because they cancel each other out, because there's so many up and down right next to each other.
But you got a lot of people going and selling these things with magnets in them, and it's ridiculous.
Sure, there's not a therapeutic level to that. Magnets can be used therapeutically, but if they're in trained hands as to use them therapeutically and why you use them that way.
And most adults, they'd have to be at minimum 1,000 gauze, and they're not going to get I've never seen 1,000 gauze in any of these inserts in mattress pillows or foot inserts.
No, it's a one-size-fits-all kind of thing.
Right.
And what they're trying to do is make sure that they don't have an effect.
An incredible stupid to put magnets in a pillow or a pillowcase when you're putting magnetic energy near the brain when a person's laying down. They had too bad that they still isn't an eye for an eye and a tooth for a tooth. Those kind of people need to be castrated or something.
I don't know if I'd go that far.
Not the patient or the client, but the person who's selling them.
Sure. Well, anyway, let's go to the next slide here. We're looking at the correct path that we should take when we have a heel strike, and the heel strike, how it works across the foot up to the front toe and then off the big toe. So as that you can look at the way that the shoe is wearing on the bottom to see whether the heel strike through the follow through is in the correct way. If it's not, you'll have abnormal wear on the shoe. So take an old pair of shoes, because that's going to be the most revealing. But you can also see it on a much more slighter effect on the new shoes. And actually, they can be a little more sensitive because they're just starting to wear. Where a lot of these people, when you look at their shoe, if this is the outside of the foot, the heel of their shoe is like a wedge as it is. They form their own wedge into the abnormal posture rather than having the corrective posture, which is we then have to put a heel lift wedge in there to help them correct that.
Yeah.
So what happens to the feet when you don't correct this? And one of the best ways to look at that is to look at an x-ray.
Exactly right.
So, Dr. Lawley, do you care to comment on this x-ray?
Well, here's two side pictures of individual's feet. And we see the toes at the bottom of the screen, and then the arch, the outline of these are really good quality x-rays. See the soft tissue, and then we see the back of the heel, and if we look at the back of the heel, we see heel spurs growing back there. Dr. Jensen will show you right there is a heel spur, and right back there is a heel spur. And so by putting the correct orthotics in the shoe, not only did the heel spurs stop growing, but they stopped irritating the Achilles tendons and the bones there, and all of a sudden the heel spur pain went away. We were also able to go in and manipulate those bones of the feet and the ankles to free them up from the subluxations and fixations that were within them. So when people come in to us for inserts for their shoes, we recommend that they have a couple visits after that where we manipulate the feet so that they are loose. It'd be much like if you're putting braces on a person's teeth for orthotics, they need to be adjusted every now and then. Mm-hmm. And there's another, go ahead, what were you going to say?
Well, I was going to say, and people have very sensitive feet. If you look at, you've got the longest and thickest nerve in the body going down to the feet, which is the sciatic nerve. And the length of the nerve, actually, it builds potential as it goes along its length. So they become very, very sensitive. And so many people have a lot of problems with their feet. They're finding that it's actually hard to walk, and it changes what's going on with their knees.
Yeah, the weight isn't equally distributed. They're either having sole contact or heel contact.
Right, and from what you were showing with those spurs coming up, that's irritation of the Achilles tendon, and the body's trying to do what it can by calcifying it and creating actually more irritation in there, and that will work up to its knees in this next x-ray. And what you see is that pronation in the feet causes encroachment on what we call the lateral malleolus, causing knee problems. And what we're doing here is we're looking up at, and usually when you take x-rays of the knees, you do it weight bearing so you can see the difference in what's going on. Now, if you look at here, throughout the entire joint, you have a joint space in there, and that's due to cartilage. But if you have a misaligned knee, you're having abnormal rubbing of cartilage and wearing away. And if you look at this, you're having a loss of joint space in here. This knee is just not right in here, and you can see, you can almost sense the pain that this person is having.
And then they go in and do surgery, and when the problem is really coming out of the feet.
Right.
The knee is a secondary, the knee pain is a secondary reaction to the foot not being in proper alignment.
Right, and when the foot's out of alignment, it doesn't have that shock absorbing. The secondary shock absorber is through the fibula, and you can see in here this little mottled work that there's actually some irritation going on here with the fibula, so you actually need to look at that joint as well to help restore natural function of the leg. So then we go on to this next slide, and this again is another knee problem. And really, when you look at something,
this is of course a youngster too.
Yes, and what you have is from abnormal pressure and function of there, you're having a disturbance to the growth site here at the attachment of the tendon that goes through the patella here. It's a patellar tendon. It goes from the quadriceps over the joint, and the patella is a bone that forms inside the tendon to protect it with how it has to work here. But it's actually forming a problem here, and this is called Osgood-Schlatter's, and it can be a very painful problem for these kids. Usually they say they're about overweight 5-year-olds are the ones that really get that, but it can happen to just about any kid, but those are the ones that it's most targeted to. Dr. Lala?
Well, there's another dimension to foot problems, back problems, health problems, and it's, of course, the feet. And if we look at it, and we've been talking about it from a natural perspective, but if we look at it from a supernatural perspective, scriptures tell us that our feet are shod in the gospel of peace. And what does that mean? That even though Jesus came in truth, he came also in grace. And the effects of righteousness, of being reckoned righteous by God through Christ Jesus, is peace and joy, or health and wellness. And so may your feet continue to be shod in the gospel of peace. If you don't know Christ as your Savior, we would invite you to do that. He's really a good guy. He loves you. He would never put illness or sickness on you. He came to heal you. As a matter of fact, by His stripes that He bore them for you on the cross at Calvary. Therefore, in God's eyes, you're already healed. Now, maybe some correction needs to take place in the natural realm, but if you'll continue to focus and get into the Word of God, feast upon the bread of life, drink the new wine, become a new wine skin, then that's going to affect not just your feet, but every cell in your body. And you can come into health and wellness. You really can. Everything can come into perfect alignment. And by the way, get yourself a chiropractor that really knows what they're doing, that has you in mind, not other things, but that is a servant, not a survivor, a servant, and you'll find good health. You really will.